One of my biggest complaints now is fatigue, with this mental, emotional fatigue. So that's the one avatar that possibly you can tell us, a story, an overview story. And the other would be children that I'm seeing diagnosed with ADD or ADDH or being on the autism spectrum. And that would be the other avatar that I'm just seeing more and more and more of. So take us through an overall story of someone who came in, they were like this, and they radically were transformed.
Absolutely. Okay, so let's start like this. Let's start by saying we understand that the brain has this developmental blueprint, right? So we all know this. We know that a baby has to crawl before it walks, right? We know that from a structural standpoint, but also from a neurological standpoint. So it doesn't make any sense to take a baby that's 3 months old, stand it up and say, okay, let's walk, right? We don't start gait training at 3 months old, right? So we know that there's this blueprint and it does not stop whenever that baby is up and walking and et cetera. That continues out through young adulthood, and then I would argue even through our older ages, right? So the first thing we need to acknowledge is that the brain has these mechanisms built in. Now, if we're going through life, and let's say that there was an issue that caused some temporal coherence issues. So some type of lack of processing along the way, be it an injury, be it a chemical or a toxin or emotional trauma, whatever it may be. But there's this blip, this chink in the chain, right? Now we start developing compensations, and we start developing imbalances, et cetera, right? So what that can look like over a period of time is maybe it's a chronic stress, right? Maybe that's a chronic inflammatory event. Maybe that's something that leads to chronic fatigue, leads to, something like depression or whatever it is, right? And so the answer then may not be going to a medication or needing something like that. The answer might be, hey, let's back up and let's examine this process. Let's check this person out. Let's look at their sensory systems, their primitive reflexes, postural reflexes, core stability, vestibular balance, eye movements, and cognition, right? And those are the big buckets, the big different categories that we check throughout our exam process, right? And so that's step one. Let's figure out where the issue may be, the functional issue, right? And then if there's something in those buckets, if you will, in those categories, that describes the therapy they need. That tells us what they need. So the exam is very, very important, that functional neurology exam, right? So if someone with anxiety comes in, right? We see that anxiety is very much tied to the Moreau reflex. Also, perhaps the fear paralysis reflex. So if we go back and we want to talk about the Moreau, so the Moreau is that reflex where if we're laying a baby down and then their arms go back and they start to scream, right? That's the Moreau. But the Moreau actually starts to develop in utero. And whenever the mom starts to feel kicks in the womb, that's the baby going into flexion and extension reflexively due to firing this Moreau reflex. Why? To begin to develop core tone. Why? So it can get out of the womb. So all of these reflexes are connected to a purpose, whether it's safety or movement or whatever it may be, right? And so if we can acknowledge that, and if this person has, for example, this Moreau reflex and it's presenting as anxiety, then that presents a very substantial and sustainable treatment approach that can greatly improve someone's life. So a good example would be, we were working with, it was a teenager, actually, someone on the autism spectrum disorder. So this will kind of get two birds with one stone. But I'll start with the first one that you brought up first. So the mom actually had debilitating anxiety. The mom was a high-level executive. She was, overworked. She has multiple kids. One of them was on the spectrum. Another one had another type of issue going on, et cetera. And so we started working with the daughter, right? And the mom was just observing. And she said, man, like I've already seen changes in my daughter. Do you think you can do anything for my anxiety? So we checked her out. Sure enough, she had a retained Moreau reflex. She also had some other things going on, some neurological imbalances. And so we deployed some very simple strategies. We educated her we treated her very briefly, not much. Okay, so we did some primitive reflex integration therapies. We did some laser and light therapy on her. We sent her home with those exercises, right? We're big on home care because for neuroplasticity to occur, we need frequency, intensity, and duration of stimulus, right? This isn't something where we do something a few times and then boom, the brain changes. Although sure, that can happen, but typically we need this type of repetitive stimulus. Home care is very, very important in our office. And so the mom goes home, she's doing her things, and she calls us about a week later and she goes, oh my gosh, my anxiety has dropped dramatically. In fact, I'm not having to take my anxiety medications anymore. This is huge. And so we're like, great, keep it up, continue doing your stuff. And then she calls back maybe a couple weeks later, I forget. And she's actually completely off of her medication. And it was because, and she wasn't exactly wanting to come off of the medication. That wasn't really her mindset. But what happened was her symptoms were improving so much that she was then experiencing signs of being over medicated, right? And so that's where she began to come off, and now she's completely off, right? So we can have huge impacts with mental disorders. And in fact, to kind of bridge the neurodevelopmental paradigm with mental disorders, if you look at the statistics, neurobehavioral disorders and mental disorder statistics are paralleled, right? And so basically what I'm saying is kids are having struggles. They're having these neurodevelopmental challenges, whether it's ADHD or whatever it may be, but they're not being treated, right? They're not actually getting to the underlying cause and developing these networks so these kids can thrive. And what that's turning into in adulthood are these mental disorders like anxiety and depression, et cetera. So there's a big correlation there. And that's what we tell everybody is